If you haven't had a chance yet to donate, it's still time to join. Certainly payroll donation is a great way to support in a small way every pay period, and you determine that amount. Whatever it is you can afford is greatly appreciated.
We are seeing a rise in our ALC, so we had plateaued for a period of time around 150 patients, but week by week we're starting to see that increase now. So we are at 185, and over the last 2 weeks have gone as high as 188.
The one pattern that still looks the same is who those cases are. On the left-hand side, you see again in orange the unvaccinated individuals, where we now see that increase since beginning of November, much more pronounced than we see that among the fully vaccinated individuals, where we also see an increase, but much less impressive slope, I would say. Even more significantly so when you're looking at hospital admissions in the middle. First and foremost, it's the unvaccinated.
You're going to hear about something called Day in the Life cards that describe some of the activity and how you'll be impacted in the EPIC world. And they're really meant to show you a glossary of some of the terminology that you'll get familiar with in the EPIC world. And then on one side of the card, it'll talk about what you did before, and on the opposite side, what you're going to do in EPIC, and just help you understand what that will look like.
Using someone's pronouns and getting them correct is a really important way to build positive spaces and to show your support for everyone's right to live safely and well in their gender identity. And it really can make a world of difference for folks when their pronouns are used correctly. And when we make mistakes, as we all will as humans, we really do ask and invite that you apologize with sincerity and then move on and try not to make that mistake again. On December 9th from 5 to 6:30 p.m., you can participate in a Zoom learning opportunity entitled Understanding Health Issues for Two-Spirit and Indigenous LGBTQIA+.
I really appreciate the opportunity to highlight the important EDI workforce survey that is being launched today. Availability for the next 2 weeks, and really important, the variety of ways by which you can participate in the survey. HHS devices, your personal devices, paper as well. And it takes really only about 15 minutes to complete, but it's such an important opportunity.
For those who remain unvaccinated on November 30, we will be issuing notice of termination on December the 1st. The notice will specify an effective date for the termination of January the 26th. We think this is a responsible timeline that provides an appropriate final notice period for those whose employment may be impacted by the policy.
So individuals who receive notice of termination will, as we mentioned, continue to work and test bi-weekly between December 1st and January 26th. If an individual becomes fully vaccinated after receiving notice of termination but before January 26th, we will offer to rescind that notice of termination.
This year is the 25th anniversary of the Articles of Incorporation for Hamilton Health Sciences, ultimately to become, a really driving force in healthcare in our region, and in our province and in our country. Happy anniversary to everybody at Hamilton Health Sciences.